Thank you very much, Madam Speaker. I am proud to rise today in this chamber to move second reading of Bill 212, the Organ and Tissue Donor Information Agreement Act. I tabled the bill on May 28, 2024. It requires an agreement between Alberta and the Canada Revenue Agency to give Albertans the opportunity to consent through their tax return for their contact information to be shared with appropriate organizations such as the Alberta Organ and Tissue Registry. Opted-in Albertans would then receive information about the tissue and organ donation process and potentially sign up to become a donor to support the hundreds of Albertans waiting for a transplant. Calgary Confederation's previous Conservative MP Len Weber sponsored a federal bill. It was a private member's bill, which was agreed on unanimously, which allowed for this agreement. BC, Ontario, and Nunavut have already followed through with provincial legislation. So today I'm delighted to tell you that this bill has already been a success. The government announced last week that it is going to happen. I am delighted to have brought this forward. The 2025 tax form will include a checkbox where Albertans can request information about being an organ and tissue donor. Too bad it took a full year to have this action move forward. It is a very simple bill, and it could have led to a checkbox on the 2024 tax return. Now, this success comes in a rather unusual way. Last week, when they announced that they would move forward with the exact action requested in the bill, I was surprised because this government have never ever passed a bill that was brought forward by a member of the NDP caucus. And at this time of fighting with everyone at every level of government, I assume they would not want to do anything collaborative, so I am overjoyed that they have chosen to move on this bill. Of course, the existence of the bill wasn't actually mentioned in any of the press release, so can avoid acknowledging that we have some pretty good ideas on this side of the House. So why is this bill important? Over 700 people in Alberta are desperately waiting for organ or tissue transplants, according to the latest publicly available data. Even though we have over 844,000 Albertans already on the donor registry, the chances of a match for all of these other patients who need them is very, very slim. The intent of this bill is to provide information to Albertans so that they can make a choice to be added to the registry and therefore increase the number of people who register to become donors. In Ontario, this number was reported to increase by 32% since the checkbox was added to their income tax forms. We expect an increase in the number of people from diverse backgrounds who register as they are particularly needed as donors. They may have simply been less likely to come across the information about being a donor from other sources. More Albertans are also becoming aware of other organ donation options, such as living kidney donation. This bill will be a way to get the word out about living kidney donation, as well as it can be included in information provided. This is especially important to those who are already open to the idea of organ donation. My neighbour Kelly has polycystic kidney disease and required dialysis since 2019. She has been hooked up to a dialysis machine 6 to 8 hours a day, 3 times a week. She cannot work, and she requires help with childcare. Family members need to drive her to and from dialysis. She is severely fatigued all of the time. She cannot participate in most family vacations, although arranging dialysis in another Alberta centre has allowed a rare brief camping trip within the province. She recently missed watching her daughter compete in the Special Olympics in Europe. This bill will likely help people like Kelly by increasing the number of people on the donor registry. But other measures that are even more critical in helping to bring transplant to more Albertans are needed. None of these could be included in a private member's bill because they all have some costs attached, although they do save us money in the longer term. I hope the minister will consider additional actions and act on them. I hope she consults with the clinical teams to understand the details of other needed steps that will allow them to share updates on what is in the works publicly. I ask her to do the right thing and to give people hope. There is no benefit to secrecy. I will continue to bring forward other good ideas. It is important to invest in rapid transplants for the well-being of people themselves as well as for the economy. Dialysis costs up to $100,000 per year per person. Transplant does have a slightly higher upfront cost, and there are ongoing costs for surveillance and immune suppression, but it is much less expensive in the long term and frees up the individuals who receive the transplant. But what are the barriers? Well, our transplant teams in Alberta are underfunded and overburdened. They cannot increase the number of transplant patients that they look after without reducing the resources, without reducing what they can do for any one individual. Therefore, we need to invest in more staff for pre- and post-transplant care. These same limited staff are also involved in trying to support potential donors through the donor assessment process. And we really need more time for them to be able to do that because donors are changing their mind. It takes such a very long time to get a transplant. To manage the people waiting for these transplants, other resources are needed, including lab resources. Alberta is only resourced to evaluate one donor at a time, and each assessment takes many months, almost a year. One after another of potential donors can be assessed. We need to be doing them concurrently, as economic analysis has shown that this is worthwhile because we then avoid the costs of dialysis. Another limit is hospital and staff capacity. I'm sure we all remember the fiasco in December 2023 when a parent under anesthetic came out of anesthetic without giving up her kidney because there was no ICU capacity for her child. Heroic measures by physicians and staff made that happen in the long run, but we're no better at this time. Hospital capacity is critical, stable staffing is needed. Private surgical centers are, as predicted and as always happens, taking needed resources from public hospitals, so the wait lists are growing for kidney surgery, for transplant surgery, and there's often cancellations at the very last minute for the patients and the donors. So from the perspective of care for people with transplants, we need coordinators, we need more funding of the team, and we need to expand the resources so we can make this happen more thoroughly in Alberta. And this will save us money in the long run. We need to increase the surgical capacity in our publicly funded hospitals, and I ask the minister to speak to the leaders of these programs and support their needs. Listen to the patient advocates who also know what is needed. Now that we know that I can be heard, I have some other ideas that I've put forward that I'd like an update on. But at this point, in conclusion, I ask all of you to register online at the Alberta Organ and Tissue Donation Registry to be an organ donor. Tell your family members that you are a donor. and I move to hear from the minister on this bill.
Thank you.